It's not easy to separate fact from fiction surrounding the coronavirus outbreak, because the fiction is so close to fact. The world is combating coronavirus disease 19 by trial and error, but the trials are based on intelligent guesses and a long history of medical know-how. Iranian scientists have lent a deft hand in working out concoctions and methods to fight the disease, which is sister to SARS. But eventually all cure is to be administered by health professionals, at home or in health centers. And our case study today is Shahid Sadouri Field Hospital. Hi, I'm Leila Faramarzi and you're watching Iran Today. Today we are out to answer these questions regarding COVID-19. From diagnosis to cure, how far has Iran advanced? And can facilities cover the number of afflicted now that there's a new wave of holidaymakers returning as well? What latest decisions has the government taken and how are they to be implemented, or how are they being implemented? And the international reaction and aid. Do stay tuned. Looking at what's literally a field of walnut, sarcherry and kingberry blossoms, it's easy to forget it's actually a hospital. But I was quickly brought back to reality as my first interviewee in the vicinity gave me the smallest details on the place. Dr. Zali is in charge of the Corona Combat Task Force. Here's some of what he said.
The building of process of this hospital is a record, because all of this assembling of this hospital was about 12 hours, and also is the record for the building of this hospital. That all of the features of a conventional, modern equipped hospital in this hospital has been arranged.
The virus first surfaced in Iran's Qom, and so it was a matter of contention whether to quarantine the city or not. Also, the country was and is under US-led economic sanctions, and now medical sanctions. Medical terrorism, Foreign Minister Zarif called it. So, as the virus spread through 30 of Iran's 31 provinces, the country found itself at a loss, even for diagnosis of afflicted cases. But just a month or two since the outbreak, the country is not just mass-producing disinfectants, masks, and PPE garments for medical staff. It is also producing diagnostic kits with 90% accuracy, as well as ventilators, which are an essential treatment.
At present, I think because of the entrance of the new kits and also some manufacturers and also some young scientists in country have been provided the facilities for doing the kits in our country. At present, we have not essential shortage of the kits, and also because of, you know, that some our knowledge-based scientists offices that are affiliated to universities have been provided the new gateways for the building of the kits and also other infrastructures that are mandatory for the early picking of the patient and also screening of the patients on the basis of the laboratory data.
5 medical research companies are each producing at least 80,000 kits a week, while around 10,000 tests a day are being carried out across 90 laboratories in the country. And Iran aims to double its testing in near future. General Araqizadeh is a doctor of the Armed Forces Corona Task Force. He will remain with us to explain treatments as we go along and as he classes the different aspects of the Armed Forces' assistance to the Health Ministry.
Hospitals have as many ventilators as their beds. As hospitals were inundated with a flood of COVID plus patients, more ventilators would be naturally needed. At present, we are manufacturing ventilators domestically. I don't know at what rate. Both state-run and private sectors are involved. Apart from that, we are importing ventilators from various points.
As for preventative and medicinal cures, Iranian scientists have been active in Iran and abroad. An Iranian scientist in Turkey has made a device that cleanses the air of dangerous gases and bacteria, as reported by NTV. Iranian pharmacologists have succeeded in synthesizing favipiravir, a drug also known as Avigan, inside the country, and Masih Daneshvari Hospital will be officially administering it. As for methods, here's a favorite of mine. Iran is trying to apply to coronavirus cases a novel approach for killing cancer cells and microbes. That is cold atmospheric plasma, CAP.
پلاسما درمانی میدونید چی هست؟
Regarding plasma therapy, I should say that the blood plasma of recovered patients is taken based on international protocols and standards under sterilized conditions. This blood is processed in the lab. The plasma of the blood is separated, the part containing specific antibodies is separated to be injected to newly infected patients who have not developed sufficient antibodies. Higher levels of antibody in the patients are expected to help contain the virus. We have started this therapy under the supervision of the Ministry of Health. It's a joint work between the Baghiatullah University of Medical Sciences and Iran University of Medical Sciences. It's underway at the same time in several hospitals, and the results will be known later.
Iran as a country will be involved in a multinational WHO clinical study for potential treatments for COVID-19, along with Norway and Switzerland, Thailand, Argentina, Bahrain, Canada, France, South Africa and Spain. This world-scale trial of the WHO's will be studying the effectiveness of the 4 coronavirus treatments, which include a drug combo used for HIV and the anti-malarial drug chloroquine. Iranian scientists have launched at least a dozen other clinical trials exploring compounds normally used to treat rheumatoid arthritis and metformin, a diabetes medication.
The Iranian armed forces fared effectively in the R&D sector. You must know that there are numerous research centers at the armed forces staff, both at the Ministry of Defense and at the affiliated universities of medical science. All of them have become active doing research on various issues. They are working on medications, disinfectants, disinfection methods and diagnosis methods. We are now manufacturing many apparatuses that we had to import. Once we had to fully import our COVID-19 diagnosis kits, but now the Ministry of Defense, military research centers and even private entities working on the contract with us are manufacturing many of such kits.
One team is infusing COVID-19 patients with the antibody-rich blood of people who recovered fully from the illness. And a group led by Hossein Baharvand, director of the Royan Institute for Stem Cell Biology and Technology, is injecting mesenchymal stem cells into COVID-19 patients.
No vaccine has been developed anywhere in the world. However, numerous research centers, both in our country and in other countries, are working on this project to develop vaccines. It's now a research project, but it will take a long time before it comes to conclusion. That would require well-equipped labs. We hope that our scientists who are working at various research institutes would be able to develop a vaccine as soon as possible. As far as medications are concerned, various countries are conducting research on various options. We are also doing our own research in our country, but we have not developed any formula for a medication.
To move on to our case study, the IRGC's ground forces have 4 active hospitals right now. Shahid Sadouri Hospital is the 5th, standing ready for duty on wheels, so to speak, because that's how field hospitals operate. They heal, then move on to answer calls for help from the next town and the next. Before Tehran, they were in Qom, where the coronavirus first broke out. General Akhavan is an IRGC commander involved in the Sadouri Field Hospital.
One of the characteristics of the ground forces health system is its flexibility in the face of threats. It adapts itself to various circumstances when new threats arise, in terms of equipment, manpower and care centers. At the ground forces, we have 2,600 fixed hospital beds and 3,100 mobile hospital beds. What you see here is a 300-bed makeshift hospital. In the face of this biological threat, this hospital has been repurposed for treatment of COVID-19 patients.
Here at the Shahid Saduri 500-bed field hospital, IRGC medical personnel are on standby for what is to come. This place includes everything a fully equipped hospital has, including the country's only portable CT scan machine and one of the only 2 portable MRI machines in the Middle East or West Asia. Some 30 of the 500 beds are ICU beds. That's a lot, as on average the country has 10 ICU beds to a city.
On the other hand, all of the backing up and also logistic facilities for this hospital have been assembled in the region and vicinity of this hospital. For example, CT scan and also logistic efforts and other logistical background are mandatory for the hospital. On the other hand, in this hospital, we have the facility of the telemedicine and teleradiology. All of this system would be digitalized. And also, I think in this process, we can provide the best and also the fast opportunity for the conclusion by the physician for the decision-making of the patients.
I got to talk to the nurses. They told me how former corona experience in Qom, Kashan, Gorgan and Babol had prepared them for their task in this capital city of 15 million people. Mr. Mashhadi is chief of the emergency ward at Saduri Field Hospital. I asked of the difficulty of wearing a spacesuit to bake at work.
ببینید یه پرستار وقتی که میره توی این حرفه این شغل قبول میکنه.
A nurse is first and foremost required to exercise patience in dealing with patients. We try our best to exercise patience and encourage people to stay home. Some people get angry with us and they expect us to take care of their patients, but we do not have enough equipment. Such challenges always exist.
I also asked how staff felt about people getting themselves sick.
حتی این لباسی که خب بچه‌ها میپوشن این لباس خب
These gloves and protective equipment are annoying. We have often week-long shifts and we can only call our families to hear about them.
My next nurse, Mr. Shahraki, is ICU man. He tells of how he and his fellow nurses get to manage a work-life balance, given they must keep away from family.
Our hospital shifts are week-long, which would be followed by a 14-day isolation period in order to protect our family and society against the virus. Some of our colleagues have been infected and are now held in isolation at home. I hope this disease would be eradicated soon.
Time for a short break. We'll be back in no time. I asked if hospital space would suffice once holidaymakers returned with possibly a second wave of the coronavirus.
We can increase our capacity from 500 beds to 1,000 beds. We have a total of 5,100 beds serving the healthcare system. We plan to double the number of beds at our hospitals, whose staff has been trained. In the end, we have more than 10,000 beds all across the country. We have 5,492 trained people, including doctors, nurses, and assistant nurses, to be deployed across the country. So far, 1,000 of them have been deployed.
Holidaymakers returning shouldn't be a nightmare actually if they're properly quarantined, I would say for free.
ببینید عرض کردم چون این بیماری هنوز نه دارو داره و نه واکسن.
As there is yet no vaccine or treatment for this disease, the only option would be to increase physical distances and lower contacts. As long as we respect such rules, we can expect the disease to decline. But if we do the contrary through social gatherings and unprotected contacts, we must wait for a new rise in infection. In our country, the pace of growth has slowed down a bit, but we cannot pin hope on such trends now. We have to wait and see how this issue would be managed in the future.
And that is one of the measures taken by government to force the chain of infection open by encouraging social isolation and distancing. The first phase of the social distancing plan went into force when the disease first entered the country in early March by closing schools and universities, cancelling religious, cultural and sports gatherings and urging people to stay in their homes, plus commencing the national campaign against the coronavirus. Therefore, unlike Italy, Spain and the United States, where the coronavirus is fast spreading, in Iran the trend of contracting and spreading the disease has become relatively stable. I said we'd make a mention of the international reaction to Iran's situation and specific response to the pandemic. Perhaps a quick review of world media will cover that to a point. For that, I give you Shahrzad.
Hi, my name is Shahrzad Manucheri, and this is the news section of Iran Today. We'll be looking online for the latest update on Iran and the outbreak of COVID-19. In an article by IFP News, we witness how Iran launches a knowledge-sharing network for medical staff fighting corona. Tehran University of Medical Sciences and an Iranian social network of healthcare professionals have launched a joint knowledge-sharing network that enables the health workforce to share their experiences in managing, containing, and curing the novel coronavirus known as COVID-19. The key point in the new knowledge-sharing network, dubbed TriTAP, is working on professional frameworks of the activities in the battle with coronavirus and preventing the specialized subjects from being disseminated to the public. Medical experts believe that laxity in the spread of specialized subjects in the media and social networks would increase the probability of false rumors and unnecessary concerns in the society. Digital Journal reports U.S. refuses Iran's request to reduce sanctions due to coronavirus. U.S. hostility towards Iran is so deeply ingrained in the U.S. policy that the U.S. refuses to even consider reducing sanctions on the country to help alleviate effects of the coronavirus pandemic. In themselves, the U.S. sanctions help create misery for many Iranians by making a poor economic situation even worse. During the coronavirus, the sanctions cause an even worse humanitarian system as it hinders Iranian efforts to fight the pandemic. Even with Iranians dying and being infected at a high rate, the U.S. had said it absolutely would not consider any relief. The U.S. warned Iran that the coronavirus would not save it from sanctions. IFP News claims Iran to use artificial intelligence in diagnosing COVID-19. Iran's Vice President for Science and Technology says Iranian researchers have gained an achievement to diagnose COVID-19 disease by artificial intelligence. Referring to the ability of knowledge-based companies to produce corona detection kits and medical equipment and prevent the spread of the virus in the country, Surana Satari said the activities of various research companies and universities operating in the field of biotech have now led to the production of coronavirus testing kits, and that 2 knowledge-based companies are currently working on the corona testing kits and have delivered 250,000 kits. In an article by The Iranian, we see Iran develops thermal camera to help identify corona cases. The CEO of an Iranian knowledge-based company announced the manufacturing of a thermal imaging machine, emphasizing that major parts of the machine are produced domestically. We can produce the machine as much as there is need in the country, Mohsen Karagar said, adding, we have succeeded in making the thermal imaging machine with a group of 5 to 6 people. He went on to say the first camera was manufactured at the onset of the corona outbreak as the machine gauges the body's temperature, and those who have fever will be identified and separated from others while passing. That's all for this segment. We'll see you next week.
Sanctions or not, in past weeks, some cargoes of humanitarian aid have been sent to Iran to fight COVID-19 by, say, the UK, France, Germany, China, Qatar, and the WHO, the World Health Organization. The EU has managed to fork out some 20 million euros in foreign aid and agrees to support the request by Iran to the IMF, International Monetary Fund, for an emergency $5 billion loan. For fear of a second wave of coronavirus, Iran banned internal travel during the Persian New Year holiday period beginning 20th March, and it shut down parks where people go to picnic and closing the New Year halls. Trucks filled with disinfectant and teams of municipal workers on foot continue to spray down streets, shrines, public parks, bins, public toilets and markets in cities hit by the virus. An important question is how the operations are supervised for efficiency, as slapdash piff-paffing would just be a waste of resources.
The Ministry of Health is in charge of supervision. The type of disinfectants, the frequency of disinfection are all determined by the Ministry of Health. Of course, the armed forces units have their own healthcare centers that have their own instructions for this purpose.
Whereas some 85% of cases get cured through respecting health issues, and just between 3 and 5% face the danger of death. And so the government is out to enforce social distancing by enforcing this: that only 2/3 of public workers appear in the office and rotate with the remaining third when necessary. As for private establishments, 1/3 of workers were to start work on the 6th of April.
Public behavior would be mandatory for this, and I think the pattern of the population cooperation would be the cornerstone of the eradication of this crisis at our country. But I think the strategy that have been approved by WHO, early detection, early isolation, early treatment, I think the attaching to this strategy would be a very good solution for eradication of this crisis in our country.
It may be too soon to reopen the country, but Iran does not have the means to pay people 80% of their wages for staying at home. Again, people's observing prevention rules, sanitation and social distancing means a lot, and the government is paying handouts and loans to the neediest several million. We covered that in earlier episodes. The already infected must observe the 2-week quarantine period, otherwise they will be penalized. But families unable to keep and quarantine their patients can refer their patients to recovery centers.
We have defined 4 hospital levels, depending on the geography, mission and the disease. We serve our people based on the type of the disease. The important thing is that we are a military force, but we will be repurposed based on public needs. We are flexible enough to help people.
One might think the military is for matters military. Well, not all wars are to be fought with guns and daggers. COVID-19 is a war waged on man by a virus, a microscopic being that is not even alive in the conventional sense. All fronts in Iran are uniting against the coronavirus, but whether the human front can breach the wall put up by COVID-19 will depend on more than the official response. It's a matter for the government, the military and medical staff, as well as the nation at large. The growing trend in the coronavirus cases in the province of Tehran has slowed down. This is not to say Iran is at a stage of uprooting the disease, but it is at a stage of controlling the disease.
You know that at present in our country, the national screening project have been designed, and about 80% of population of country have been screened by this national screening system that is on the basis of primary health care, and also because of the very good established setup of the primary health care in our national health system. I think it would be a very good purpose for other countries.
And there is the possibility the curve of affliction will peak again in autumn, but the possibility is slim. The coronavirus also surfaced in the southern hemisphere. So why do we think it'll die out with the heat?
طبیعت ویروس‌ها به ویژه ویروس‌هایی که مولد سرماخوردگی‌ها هستند.
The nature of viruses, especially those causing cold like flu and the previous coronaviruses, survived cold weather, but they disappeared in hot weather. But this novel virus, due to its genetic mutation, has become more epidemic. Therefore, nobody knows for sure how it would behave in hot weather. However, since it's a coronavirus and viruses disappear in hot weather, COVID-19 is likely to have a lower rate of contagion when the cold season ends.
So many questions lingering when the Pentagon is said to have been aware years ago of the likelihood of a pandemic brought on by a novel coronavirus. It had predicted with startling accuracy shortages of masks, hospital beds and ventilators that could occur in an outbreak. To quote the nation in bringing up a 2017 internal document. That's it for today. Thanks for watching from the whole team. We've a long way to go with the coronavirus, however, and there'll be several more episodes on this show, Iran Today. So do watch at the same times each week, and don't forget to leave your comments and topic requests. Bye for now.